We at Judi Health are super excited to have you join us for Unified Care Navigation, a critical component of the future of health benefits design. A couple of housekeeping items I mentioned. So the replay will be available. We'll send a follow-up email out with the recording. I encourage everyone in the audience to use the Q&A at the bottom here of the Zoom window. Ask questions along the way per usual. We'd love it to be an interactive discussion. And we're not going to be running through slides. It's not a slide-heavy webinar today. It's more of a fireside chat. Andy has a show and tell in the middle to give everyone an idea of what we're working on. So we're excited to see that. And without further ado, I'm just going to get right into it. So I want to thank everybody again for joining us. And I'm going to turn it over to Sunil and Andy for quick introductions to start, and then we'll get right into it.
Great. Good afternoon, everybody. I am Sunil Budhrani. I'm the Chief Innovation and Medical Officer here at Judi Health. I've been here about 4 years, and I always say time flies when you're having fun and trying to change the healthcare universe here. I'm a practicing ER physician on faculty at George Washington School of Medicine, so still have played the ground game in the emergency department. Prior to here, I was with one of the big three health plans as a chief medical officer and market leader, so spent a lot of time in the payer space. And previous to that, many years in the health system space, primarily practicing leading health systems in that part of the country. So I look forward to the conversation, and I'll turn it over to Andy.
Hi, everyone. I'm Andy Kageleiry. I'm our Senior Vice President of Enterprise here at Judi Health. I came to the company by way of an acquisition. I was previously on the management team at Amino Health, which was a standalone care navigation, digital care navigation platform that Capital RX Judi Health acquired last year. I spent the 15 years previously in a variety of roles in healthcare, first as a management consultant and a data scientist, and more recently in digital health startups, in particular on the pharmacy side. Here at Judi Health, my responsibilities are over a lot of our enterprise relationships and bringing the Judi Care unified care navigation platform to the market. Pleasure to be here with everyone today.
All right, thank you both. And this is going to be fun. It's actually like a live podcast episode for me. So, Sunil, why don't you start us off here, frame things up? Healthcare, it's historically been slow to change, and then things happen very quickly. It feels like we've seen a lot of change recently, especially to start the new year on the regulatory front. But what's the overall goal of care navigation? How have health plan members historically explored the system to find where they need to go for care? Or if they have questions, to get those questions answered about their health. Asked differently, like, where are we coming from? What's the past like?
Yeah, it's a great question because I always say that you can't fix a problem unless you understand how it originated. And so when I look back and I think about, my career as a physician, and we go back 20, 30 years, I'm not trying to date myself here, but when I go back and I think about, how patients navigated their care to come find me in an emergency room, it becomes very obvious how we've transformed care navigation to where we are today. So where did we begin? So we have to remind ourselves in the United States, we're a predominantly fee-for-service reimbursement model. What does that mean? That means when you seek care from me or any provider, when I engage with you or do a procedure, prescribe you something or something, I'm paid for every encounter I have with you and the parts of that encounter. It's a fee for service. That has created a model historically where the more I see you, the more revenue I generate, for good or bad. But that's the reality of the chassis that the healthcare system in this country has started with. So as we think about 30 years ago or more, how patients and doctors and care providers saw each other, you would see your primary care. And your primary care would evaluate you. And often what would happen is, if it exceeded their scope of internal medicine or family practice or pediatrics, I'd refer you to a cardiologist if I was concerned about your heart. If I was concerned that you were having neurologic symptoms, I'd send you to a neurologist or even a gastroenterologist if you have stomach problems. And then that specialist would then evaluate you and repeat a series of tests, but relevant to their specialty. Again, feeding into the fee-for-service model. So this kind of previous care navigation was a primary care quarterbacking your care and then sending you to the appropriate specialty that needed that special attention. Now, if you didn't have a primary care, then you ended up in places like the emergency room and came and saw me, which happens very often and far more. Believe it or not, we thought as care navigation continued to improve and advance, we thought we could control the volumes in the ER by providing places, alternate options for patients to go. Things are definitely getting better, but you can clearly see the ER volumes are not going away, and that has a number of reasons. But care navigation in that time, 30 plus years ago, involved primary care to specialist. And if you didn't have that mechanism because of insurance, knowledge, confusion, and a number of barriers to understanding the healthcare system, you went to the ER, which was an expensive place for me to take care of a sore throat. It was an expensive place for me to take care of a minor rash. And that's where we saw over the years a realization that we need to manage. That word was starting to use more and more in the 80s and 90s. We managed care became a coin phrase during that time because the realization was made with a fee-for-service chassis and a primary care specialist quarterback that care, and those who just don't understand the system showing up in the ER was not going to control costs. So hence, we ended up in a managed care scenario where we started expecting primary cares to do much more than just take care of patients, send them to specialists, but really manage the totality, the holistic care of a patient with the thought of outcomes in mind. Another buzzword that started being used more and more in the 80s and 90s. The notion of incentivizing providers on outcomes, value-based care. You can't have a conversation in healthcare for decades about value-based care. How do we promote disease prevention instead of disease reaction? And so that was kind of historically the way that care navigation occurred when it came to patients and providers, and the evolution to thinking about managed care and outcomes care, but it still had a lot of work to do 20 years ago.
Yeah, Sunil, and if I think about this, I'm cursed with unfortunately the affliction of being a former management consultant. So I measure everything in threes. Okay, I'm sure there's some consultants on the call who hopefully get a kick out of that. So if I'm thinking about the ghosts of CareNav past, there sort of were three solutions, and you touched on probably two of them here. One is a referral, or sort of navigation by the most expensive possible navigator who wears a white coat. If you move a little bit forward in time, you've got carrier directories, right, which are effectively regulated into existence, and they should exist, but are fairly simple tools that are helping do a job, which is find an in-network provider, but maybe not navigation per se. Although I think, frankly, if you look at the country even today, that is still a mode outcome for where members and employees are going to actually identify care. And then third, these models that arose in the 90s and 2000s and still operate today, which are very people-powered processes. So not necessarily your referring physician, but care navigators that are hired by self-insureds to provide a really bespoke white glove and oftentimes very good experience that is, I think of as akin to care management, right? So these are models that are hard to scale because they're not inexpensive, but do a good job because you're sort of you're assigning case managers and human navigators to help people operate in the system. That model works well for very expensive cases, oncology, surgery. Look up any COE vendor, the same disease states. We get a lot of attention there too. But those are the models that we've seen historically speaking. Justin?
Yeah, I think it's interesting. I have like a real life example, and I think everybody can probably relate to this. Is that at one of my men's league hockey games the other night, and a buddy on my team knows what I do for a living, and he was like, "Hey, we just switched our insurer, our health insurance from my employer back to our previous insurer from 2 or 3 years ago. And like nothing worked again. And he's like, I go in to sign up, I go in to look for my doctors, I go in to try to figure everything out. And it just seems like a lot of the information in that portal is like wrong, dated. It's just a challenge to navigate. Um, he also had a problem picking up a prescription because the card changed. And when I think about this and I think about it, like he went on to say he's using a point solution or an app for PT hockey. I'm not surprised. We're too old to be playing anyway, right? But so he's using an app for PT, but he's also using a nationally recognized, like to Sunil's point of it, direct primary care. Well, he's using one of the subscription services for primary care because it's easier for him and his family. That's a separate discussion, but it's related. So like Andy, my question here is like this is the current kind of state of things, isn't it? I mean, many people are trying to like piece it together themselves and use things, but they're trying to use the benefit that their employer or their health plan's offering them. Does it depend on the plan design and the partners an employer has? Like, why is it like this?
Well, good question, Justin. And this is a good opportunity for me to steal a phrase that I've heard Sunil say many times, which is that members are over portaled. Okay,
Okay.
so we talked about the sort of original, the old guard formats for navigation. And if you look at more recent history, there's been momentum to create more digital solutions and digital point solutions in particular. So especially in the last 5 to 10 years, you've now got the opportunity as an employer or plan sponsor to purchase of course, you're going to, if you're sufficient size, you're going to have a medical benefit, you're going to have a pharmacy benefit. You may network or contract with a navigation vendor, and there are many, and many of them are digital. And you may also elect to add other point solutions that are oriented around a disease state. There are many well-known players for MSK, for diabetes. There are some that seem to be popping up that are just oriented around GLPs now, right? Anyone on this call who's a benefits leader can probably, name 5 or 8 or 12 point solutions that you've either contracted with or looked at. And this is ultimately a good change because it means that we're now bringing technology solutions to solve problems that, as Sunil and I talked about before, were very expensive and solved sort of in the most rudimentary and expensive way 15, 20 years ago. The problem, though, more recently has become that there are so many options for an employee at a self-insured employer where they sort of say, gosh, I don't even know where to start, and they're navigating. Now I have a new navigation problem, which is I have so many different solutions that are available to me that it's hard to know where to look and where to go. Now, that brings us sort of to the reason we named this webinar Unified Care Navigation, which is what we vend here at Judi Health and with the Judi Care product. So in a moment, I'm going to share my screen and sort of show you, but to give you a sense of what we mean when we say unified care navigation is we've seen over the last few years, and this is frankly why Amino and Judi Health joined forces last year, is a move from point solutions to platforms. Employers, plan sponsors, plans themselves want to create a single digital platform that members can interact with that can answer as many questions as possible and provide routes into as many of the different point solutions or digital or even brick and mortar options that they've provided to their members. One thing I like to tell folks I talk to, benefit leaders I talk to, is you've done so much work and are spending so much of your precious time and resources selecting a medical carrier, a TPA, an RX vendor, a PBM, and all these different point solutions. Now you need to drive engagement with it. And the way to do that is creating a single platform that you can point to and say, when you have a question about your benefits, go here. So that's sort of that's a central thesis for us as Judi Care and why we created this unified platform.
And you don't have the fragmentation problem that my buddy has and his employer has, right? It's like he's going kind of outside of the benefit to get care because it's easier for him. But you
And
know,
as Andy mentioned, this is an important, I'm not a management consultant history guy here, but I think it's important to understand that I like the way he put it earlier. It's like I think about things in threes as well, without even doing the management consulting background. Phase one, what you've heard us say, was a primarily humanistic component of care navigation. Primary care, specialty, and then you add nurses and teams that would help coordinate your care, or you ended up in the ER if you didn't have any of that kind of benefit. Phase two is exactly what Andy was talking about, which is now you have the emergence of point solutions, but difficulty identifying where to go. So I call the first phase human chaos, the second phase point solution chaos, and then we'll talk about the kind of the phase three of where we bring all this together. And Andy has an amazing kind of demonstration here of where we think the journey is going.
Okay, great. Well, first and foremost, I'm going to show you this is my demo environment for Judi Care. So this is actually the care navigation platform that we at Judi Health vend. And we vend this to our Judi Health clients on the medical side. We vend this to our PBM clients on the pharmacy side. We sell this on a standalone basis. And this is not a sales webinar, but I want to help everyone on the call understand that a lot of the power of what we bring to bear through Judi Care ties off the fact that we are adjudicating pharmacy claims, we're adjudicating and processing medical claims. And so we've got some pretty cool stuff that's built sort of, I say, straight down to the metal here and is unified across the pharmacy and the medical benefits. So, Justin, can you see my screen?
Absolutely. Yep. Go
Okay,
ahead.
great. So you're looking at the Judi Care Unified Care Navigation Platform. Everything here is centered around the search bar, and we want to be able to tackle a few sort of fundamental things. First, we want to be able to give you the absolute basics you would need to drive the really administrative use cases, right? So we have, as you can see, we have the access to your insurance card, we have access to your recent claims, we have access to in-flight prior authorizations, right? So all of the sort of fundamental ops you'd expect from a carrier or a PBM are all in the platform, okay? Likewise, we load all of the point solutions that your individual employer or plan sponsor has elected for you. You'll see that more as I get deeper into the experience as well. But as we've talked about for the last 20 minutes, we want this to be a totally unified system so that members can go to one single place and access everything. I started by saying everything's oriented around a search bar. It's 2026. Folks want to be able to search for what they need. We've been 20 years into that paradigm, right? So in the search bar here, you can search for a provider by name, a specialty, a condition, a medicine, a pharmacy. It's again, it's 2026. Your old daughter has an infected bug bite, and we will route you to the right type of care, whether that's a point solution or an in-network provider, and then we'll actually make recommendations. So again, I'm in a demo environment here, so I'm going to click through a bit. We're going to look at an example of a dermatologist search. So here, I'm seeking a very specific type of care. I've already to call out. First, you've got a map view and a list view. Okay, this is meant to be similar to something you'd see on a Yelp or on any kind of modern consumer platform. Okay, you've got the relevant point solutions are going to be highlighted alongside the list of providers and facilities. We worked with, so as a Judi Health employee, my medical benefit is through Judi Health. And so our human resources team worked with the Judi Care team to identify the point solutions that they have identified that are important to us and the right places for us to surface those. So we actually made decisions together about should we put MD Live in this case? Should we put a telehealth vendor in front of dermatology searches? What types of searches should that look like? Okay. The other thing I want to call out is that when we're showing you providers, we're opinionated about providers, okay? So we have a concept in Judi Care we call top provider, which routes you to in-network, high quality, and that means quality on appropriate use of care and outcomes of care, and cost-effective care. So yes, you can see all 100 in this case. dermatologists that are located within a 10-mile radius of our HQ in downtown. But we've pushed to the top the three that we call top providers who meet our criteria for network status, quality, and cost effectiveness. So I'm going to click into Dr. Castillo here just to give you an example of what these profiles look like. Okay. When you're looking at care, we follow a principle here that I think of as like the pyramid principle, which is for someone who's looking to go as quickly from a search to a care recommendation and a care decision, we want to make that as fast and as easy as possible. For members who have stronger opinions, who want to sort, who want to parse, who want to filter, we also expose the kind of information that that person would want to see. So right up top, you understand that this is an in-network, cost-effective, high quality, and frankly, highly experienced provider. We've got a customized summary of every single provider in the platform generated here so that you can actually read more about that. We have driving off of our proprietary data sets, we have information about the conditions this provider treats and the ones that he disproportionately treats, even relative to his peer set in dermatology in the NYC area. And we give you information about the quality of care as well. And we'll show you on sort of a ABC letter grade type of format, how we determined that this provider was high quality. There are so many what I call engagement features that we've built into the platform. I'm going to highlight just one of them for you here, which is that we have integrations with over 100,000 providers who have actually put their live inventory of appointment availability into our platform. So you can actually, for about 100,000 NPIs, you can actually book an appointment directly from the platform, which is an awesome feature because the next thing you want to do when you found the provider that you're excited about or the care you want is to actually start setting that up. And so we've got a flow here where you can see their available appointments, go straight through the booking flow, and actually get yourself directly confirmed. And this is not vaporware out to a contact center. This is actually directly pulling from the EMR at the point when you're looking at this provider, which is awesome. Okay. What I want to do next is just show you what this looks like from the pharmacy side as well, because that's part of the power of us being unified here. So I'm back out to my homepage. I'm looking for albuterol. My son takes albuterol. So just to show you what this page actually looks like as well. Very similar with respect to, I'm showing you results and I'm showing you a map view so you can figure out where precisely you ought to go. On the pharmacy side, we really orient this around price and member price. So you can make your configurations here about form dose quantity. You can see the pharmacies that are closest to you, and you can see what you will actually pay if you walk up to the point of sale. This is an advantage we have because we are a PBM, because we adjudicate claims and we have rails that are directly into the point of sale, where we can actually show you what that is going to look like. And on this page, you can see things like your deductible, your accumulators, information about the pharmacy, their hours. So we want to be able to go from a search bar where folks can look up anything they need in terms of interaction with the healthcare system, and actually get as quickly as possible to help them make a decision. And that's what, I think to bring this sort of back up to the surface, in 2026, we should all be expecting from care navigation, right? It's actually on your network, your preferences as an employer or plan sponsor, and giving people the information they need to actually make a decision about care.
Andy, we had a couple of great questions come in while you were talking there. Thank you, Maureen. Maybe two of them just real quick. And by all means, everybody keep the questions coming. We'll get to them. We have another, question and part of the presentation to ask Sunil and Andy. But where are you collecting the provider data shown? And then PPOs struggle to keep the lists up to date. Kind of talked about that a little earlier, but we just glossed over it. And then do you have access to all EMR systems or just some?
Okay. I spend a lot of money buying data and I have a big data science team. I don't necessarily know that I want to disclose exactly which data I provide, but I will say we purchase claims data. We work with vendors, and I would say the industry leading vendors for a whole bevy of folks who provide quality data, who have metrics on providers, on facilities, and we have a data science team. We're very opinionated in-house about how to measure outcomes of care, appropriateness of care, and cost of care. And we have algorithms that we put together that help you sort of figure out what should be the top provider. In terms of our EMR integrations, we work with a few different partners actually who help us drive those direct connections into the EMR. So we actually have connections into probably over a dozen different types of EMRs. And like I said, we have over 100,000 providers. It's pretty concentrated in sort of the lower acuity settings, which actually tends to be where we see more of the digital bookings happen, PCP, OB, that kind of thing. Hopefully that addresses the questions, Justin.
Yeah, no, that's perfect. Thank you. And that looked great. It's very cool to see. Thank you, Andy, for walking us through that so we can visualize it. A quick reminder, we just hit a couple of the questions. Bring them. We're happy to spend as much time as we can. If we can't get to them at the end of the call, given the amount of time we have, we'll certainly follow up with you and try to answer them. So Sunil, let's flip back to you here. What's your hope for the future? I mean, we've talked about the past. Andy just showed us the kind of current and very near present,
Yeah.
current state. How do you see things looking and working? Like if we look out 2 to 3 years, things are changing pretty rapidly now. But if you had to hazard a guess, what's your vision of the future look like?
Yeah. So what you've heard from Andy and what he's demonstrated is kind of the inevitable direction. With the advancements in technology in the last 10, 15 years, when it comes to video, web speed, access to device, hardware, software enhancements, what you're seeing was the inevitable happen from that first phase I talked about, where it was predominantly human-centric, providers, patients, care navigators. You see the inevitable transition to that phase two, which he showed you was how do you organize point solutions? Anybody who's been in this industry long enough knows every couple years you'll hear about a diabetes vendor and then they're gone. Or you'll hear about a behavioral health vendor and they're gone. And I always say you don't need 15 diabetes point solutions and 20 behavioral health point solutions and 7 musculoskeletal. You just need ones that work and work well. So what Andy was showing you was the ability and the opportunity now to organize this term I used before, some of the healthcare navigation chaos. We called it in my previous world, know where to go, KNOW, where to go in healthcare. Because if you educate the consumer, they can make wise decisions. The problem in healthcare is you have barriers to education. So our focus with the Judi Care platform, and you can see the evolution, is to create a platform so people can make their own educated decisions. Now, Andy used a phrase that I've been saying for decades, which is patients are over portaled. What does that mean? That means their doctor has an EMR and they have a portal for their EMR to access their patients. The health system has a portal to access their health system experience. Their PBM has a portal to access their pharmacy experience, and the health plan has a portal. This creates what I call technology confusion for the consumer. They cannot understand where to go because you're giving me 4 portals that are not coordinated. So what the important thing to realize is you're seeing in the last 3 years, I'll even put a number on it, a number of companies create portals to try to consolidate this confusion. What makes us unique as an organization is if you connect the infrastructure with the front end, the plumbing, the claims processing, the benefits administration, the payments of providers, with the front end of Judi Care or any portal at that matter, then you create an opportunity for the patient to make intelligent decisions. At our company, Judi Health, we went live as one of the first companies in the United States to process an infrastructure of medical and pharmacy claims on Judi about 15 months ago. But then we layered on a front end Judi Care to connect the back end with the front end so that our employees scattered across 50 states could then see, based on their condition, should they see a telemedicine visit? Should they go to an in-network primary care provider? Should they go then seek a clinical vendor like a women's health solution, a telemedicine solution? We built our system so it's plug and play. We're a provider network, a clinical vendor solution, any women's health, whether it's a Progeny or a Maven, a telemedicine vendor like a Teladoc or MD Live. You create a place that's an ecosystem around your patient population. So I believe the future is now the third phase that I was talking about, where it's a hybrid model. It's leveraging providers like I talked about where we started. Physicians, mid-level providers, nurses, caretakers, care managers, care navigators. And then you couple them with technology like point solutions, like remote patient monitoring equipment, like telemedicine, like text and chat. And then you have a back end and front end architecture that lets the patient navigate clearly where their experience should go. So if they have a cold, they know telemedicine's an option instead of the ER. If they fell down and need stitches, they know an urgent care is better than an ER. And if they have chest pain and they have shortness of breath, they know they then need to go to the ER because the front end portal is connected to the back end experience to navigate that patient properly. And here's the important take home. I believe strongly if this coordination of care occurs, you can deliver higher quality care at lower cost and serve the important stakeholders, namely the patients. And this gives employers the ability now to provide solutions like ours to their employee populations. 50% of Americans get their care through their employers, and then many, many more get it through a federal program like Medicare or Medicaid. If we deliver these solutions through those channels, people can make educated decisions and the cost of care doesn't become a massive burden on taxpayer dollars and employer payer dollars.
I'll add a take to that, Justin, on sort of where the future is, and I'm gonna sort of give the folks here a little bit of a sense of what we're building to on top of this. So, one of the through lines, one of the threads we've been talking a lot about today, without saying this word, is personalization, right? Which is effectively we go from a system where on one hand, a primary care giving you a recommendation is totally highly personalized, but not scalable outside of the sort of, in the moment of care delivery itself. When you get to these digital experiences, something we've thought a lot about is how can we personalize the search to you as a member? So again, I mentioned before in our platform, at least, we're going to load your specific network, you a plan sponsor, you a member. We're going to try to drive decisions off, demographics and gender, and age to the extent that we can. But I think we're on the precipice now, and this is where I think, frankly, we have an unfair advantage, which is we should be personalizing recommendations now even more around that are driving off claims in your actual health history, right? And so I expect a lot of navigation to go from, personalized at the employer level to personalized to N of one, right? Where we should all be expecting from navigation, not just I'm an employee of Judi Health, we use XYZ network, we have ABC telemedicine vendor and getting recommendations there, but my claims history can inform, if I give permission and if we use it the proper way, can inform decisions about what I do next. And so I'm really excited about a future where we make N of one level navigation decisions that are as personalized as possible. That requires data, that requires computing power, that requires did we make it this far without saying AI? I think I said it maybe once before, but we're doing well overall, not using the buzzwords too much. But yes, AI to actually help inform those decisions and even the modalities that you interact with the navigation platform. So I'm really excited about what we're building on here.
Actually, yeah, Andy, that's a funny comment because I totally agree. You can't go to any conference, let alone a healthcare conference, and hear the word AI, right? And I always say there's a macro opportunity for AI and there's a micro. If you are able to connect again back end claims plumbing with front end care navigation and create absolutely that personalized experience between the individual and the employer, and then you can overlay what is called next best, and he was alluding to like these next best actions, because now I know what is going on with the member and I can recommend the next best action before it even happens. If we do our job right in healthcare, this goes back to my fee for service conversation in the beginning. If we do it right in healthcare and we bring all these fragmented systems together, not only can we create this better personalized experience for the employer and the patient, but then we can prevent disease and really care about outcomes and then incentivize providers financially by rewarding outcomes. We've never had a chassis like this to reward providers on keeping people healthy instead of treating disease.
Yeah, it's exciting. We've got a bunch of great questions here. We're going to try and get through them before we do have a hard stop at 1:45 Eastern, unfortunately. Just trying to jam this in a busy season. But I'm going to go with Justin Leaders. Thank you for the question, Justin. So does Judi Health support backend workflow controls that allow us, being benefits, brokers, consultants, advisors, to intentionally design care pathways, knowing human behavior defaults to what's easiest. In other words, can we structure the experience so the right path is the easiest path, and that we can present the right point solution in some cases, if that's
Yes,
the right
yes,
path.
yes, and I think you should expect this from your navigator as well. This is sort of another way to answer this is this should be personalized to the plan sponsor. So one of the most common requests I get when I'm in market talking about Judi Care is um, I love that you have a default view, Andy, about providers, about top provider, about algorithms, about where point solutions to surface. But I operate my own health system. I would like those providers to surface first. We have very strong opinion. We love this point solution. We want it to show up and not just show up in line. We've carved out fertility. I want to show only that option on the page for fertility searches. Yes, we do those kind of customizations on the medical side, on the pharmacy side as well. Because ultimately, to my point earlier, you are spending so much time and money on your benefit, designing your own benefit. Your navigation tool should be furthering your objectives with respect to guiding care to help manage costs, to help your folks get the best kind of care. That there are it's hard for me to think of customizations that aren't possible at least in our platform.
Yeah, it's pretty cool. And you just answered a question from Ricky in the audience too there. I think that network configuration seems like a pretty big deal going forward, and the flexibility you'd have there. So that's cool. We have a good question on security, of course. Not surprised this popped up. How do you manage data privacy, especially with claims and pharmacy data under one stack? Thank you, Yogita.
So Neil, do you want me to take this or do you want to do it?
I can start and feel free to pile on. So I always say, having been in the plan industry and even health systems, it's very apparent in the last 10 years, especially, that healthcare breaches have occurred on the payer and provider level at an exponential rate. And this is not rocket science. It's very clear why this has occurred. Most architecture in healthcare is 20, 30, 40-year-old, if not older architecture that's layered on top of each other, and that creates a bunch of vulnerability. Because of much of what Andy talked about and way we have built our systems, we have built organically, from scratch. And it is important to understand, I always say, we are a cloud native API friendly architecture that was built from scratch. So we create a bar of security that includes FISMA, FedRAMP, SOC 2, and many others that exceed the expectations of the healthcare industry. One record has always been known to be worth 10 times more than a credit card breach. We take this very seriously, and we have our own bar here.
Nothing to add.
All right. Um, Good question from Joe. Thank you for this. What we were showing before was that the member or the like consumer view? Do you have a similar view for the employer plan sponsors or the leadership team that's running the benefit?
Yeah, so that was the consumer or member view. Yes. So that is I am a employee of ABC Corp. ABC Corp is contracted with us in this case to buy some bundle of services that includes Judi Care. So I, as an employee, am interacting with the user interface that you saw. Um, so two things I would add. One, we call it like an impersonation or a concierge view. So for folks who maybe you're a TPA partner, maybe you're some kind of platform that would like to be able to provide some level of human-powered care navigation, but use this system. Okay. Um, I have tech that lets you do that. So someone can call 1-800 ABC Corp claims adjudicator and actually look at that plan member's specific view to answer questions about the accumulator, about where to go next. So to sort of provide a analog equivalent to what you're seeing here. For the employer, look, we do all of the configuration and we can do it very quickly for employers. Like I said before, we kind of have an out of the box version where we're very opinionated about where and what to show. And if you want to do customizations, we can manage that for you. I think the most salient thing that we do is we provide a lot of reporting. On the back end of use and where your folks are going and helping give you a lay of the land of what the actual usage of your programs and systems actually are.
I don't think we're gonna have enough time to do another demo or look at like the employer side of things because we only have a couple minutes left. But I think we're happy to follow up on that if, right, Andy, or if we want
Sure,
to,
yeah,
yeah,
happy.
okay. And then this is a good question to follow up from Yogita. To what extent does the navigation engine kind of personalize guidance? I think what you were showing earlier, those are in-network options, and what we're suggesting here is that, this is the preferred path, and you can configure that to your liking based on the resources you have. I mean, we heard last year a couple times there were plenty of employers, sadly, but interestingly, that have over 30 point solutions bolted onto their plan for different things. So I have to think, being able to steer in a positive way members toward in-network resources is helpful. Um, I hope I'm getting at the question here, and you can maybe build on that, Andy or Sunil, but I just want to try to address that before
I,
we.
I'll take a quick stab at that. So we've built it so it's flexible. And this is really critical because it's very key what Andy said, personalization and building a healthcare ecosystem around you. The systems even also created the steerage point is very important because more and more we're realizing the landscape of healthcare in the United States is changing. Employers are demanding, health systems are demanding, patients, more importantly, are demanding. The status quo is now in a tipping breaking point. So, solutions that steer to highest quality, efficient, lower cost solutions is now an expectation. Our platform is designed to let you plug and play, pick and choose, and identify your world that you want to offer to your employee population. And the beauty of it is, it lets you assess through analytics how that plug and play puzzle you've created for your population is working. It's not just about patching together a network and clinical vendors, it's about assessing it also. So we give you the opportunity to put it together and then measure the success. And for our employee population, that is an example, in our first year, we were able to demonstrate a more robust plan than we've ever offered our employees in 50 states and kept our premiums flat or lowered it in our second year, which is rather unheard of in an employee offering.
Yeah, it's amazing. And we're at time here, but there's one more question that I think we should answer or try to answer for Bud. It's just the belief that the technology is more effective than talking to someone that can navigate them, assuming the navigator is properly trained. I think, Andy, you touched on pieces of this a little bit. You want to take that one?
Yeah, sure. I mean, look, let me think of a couple different alternatives here. So the first is I would never assert that a digital platform, no matter how many claims I have, is going to replace someone in a white coat. Okay. So And that's not just
I'm,
because
I'm
I'm on a
glad
webinar
you
with a
said
guy
that.
who can
I'm
wear a
glad
white
you
tee.
said that because
Okay,
I'm still working on.
well, I mean, jokes aside, like this is not an MD, this is not a DO, this is not an NP, this is not somebody who's in the clinic with you who can put their hands on you. So I would never assert that. So let's put that aside. And look, I also think that there are times when a case manager who can spend an hour on the phone with you can exceed what this platform can, especially if that person has access to the kind of data and information that we use in this platform to help you. It's one thing to be able to sit side by side with you or even if that's on the phone and help you navigate a really challenging situation. And we are years away from technology being able to have that kind of bedside manner, for lack of a better term.
Mhm.
Um, Here's where it works better. One, it's software, it's scalable. So the truth is, a lot of the people-powered processes and people-powered care navigation platforms are costly. And so this is a solution that can be rolled out at significantly lower cost because it's software and it's digital. Um, and there is a lot of promise about we have we have sophisticated teams that use a lot of data so we can get very smart about what the routing is and have data driven, not just anecdotal opinions about who and what to go do next. And as I talked about, this can be increasingly personalized. So we're never going to replace Dr. Budhrani. We may only replace, some share of what a human navigator can do, but we can do it for so many more people than actually have access to a navigation platform today, who right now are only able to do this in a PCP's office, in an ER visit, in their carrier's directory. And there's a huge gap that we think is an opportunity for us to help make an impact in American healthcare, which is right in the center of all of that. And that's what our sort of mission is in the Judi Care team.
Yeah, and it's super nice as a consumer to be able to see all of your options that are in network in one spot on one page. You can just scroll and say, okay, here's my MSK resource. Here's my, family planning resource. It's all there for you. So, and our clinical care teams do a great job of kind of personalized handholding if there is a PA or something else that someone need that resource is surfaced. I'm sorry, that information because of the resources we have is surfaced to them right at the point of the call. So it's at their fingertips. Um, Andy and Sunil, we're over by a little bit. Thank you guys so much for taking the time today. Thank you everybody in the audience for joining us for this webinar, fireside chat, and we look forward to staying in touch with everybody. We'll follow up with the email with the replay. We hope everybody has a great rest of your day.